So I am here with Jody Evans from HCA Healthcare. She's here to talk about some of the positions that they have. So if you could please tell me a little bit about your organization to get us started.
Of course. Well, hi, everyone. We basically are HCA, which is Hospital Corporation of America. And truly, we have 7 hospitals here in the Denver area, as well as clinic services, surgery centers, and lots of different kinds of things. And so we are just one little niche in the big wheel of HCA. And we actually have about 180 hospitals throughout the United States, as well as some overseas. We have a facility in Alaska, lots of different places that you can actually get to and be able to do healthcare careers. And there's lots of different things that you can kind of do with that. So again, 7 hospitals here in the Denver area. But with that being said, we have been, I can't even tell you how long we've been around as far as that goes, but again, about 12,000 employees here in the Denver area.
Wonderful. And then can you tell me a little bit about the entry-level jobs that you are hiring or you're currently recruiting for?
Okay, so we basically do any kind of positions, all the way from housekeeping to CEOs and those different kinds of things. So there's a lot of different areas that you can actually get into. Something kind of with little to no experience obviously would be the housekeeping kind of things, food nutrition services in case you have any kind of restaurant kind of experience, customer service. We have registration that we have a lot of students that are going into just to kind of get a feel for the actual positions and getting into some of the hospital information, which would be kind of insurance and billing and those different pieces. But outside of that, other kinds of things would be, I know, my daughter actually is in high school and she is doing a physical therapy assistant program. And so that's something that we do offer entry level as well. So again, it would just kind of depend, but a good spot to kind of get a entry level piece of things would be a unit secretary. And one that I've found that a lot of folks like to get into would either be on the nursing floor or actually within the emergency room, just because then you get to see all sorts of action.
And are you currently hiring for part-time, full-time, seasonal? Do you have a requirement for anything like that?
We do both part-time and full-time. More seasonal is not typically something that we look at, just given that we're hoping that folks are going to get there and they're going to love it and they're going to stay. But for the most part, it could be something that definitely you could be per diem, which is PRN, kind of as needed, if you will. And so that's something that we can kind of keep folks on the books so that when they do go away to school, they can come back during their off times and be able to kind of work with us still during that time period.
What kind of requirements do you have for some of your more entry-level positions?
Well, basically where we kind of get a little bit stuck is just that a lot of things are going to require a high school diploma. Not everything does, but most of them do, as well as just being 18. So that's kind of something that we do that will kind of impede us from having some of these young folks coming in. But for the most part, we like to do any kind of volunteer work. We do have lots of volunteers that we can actually get moving into positions. But for the most part, it would be kind of your high school diploma, as well as maybe some volunteer hours or those kinds of things. But for the most part, just kind of high school diploma and 18.
Do you also hire CNAs? I know many of our students are pursuing their CNA. Is that something that you are recruiting for?
Yes, absolutely. I didn't even say that. I apologize about that. CNAs is a great option as well to kind of get into the system, only because you again get to get on the floors, you get to network with the nurses and meet lots of good folks and just really show off yourself, really showcase what you are looking to do down the road, if it is nursing or if it's doctor or, physician assistant, any of that kind of thing. You're able to kind of really do kind of a working interview for what you're going to be doing down the road.
What is the salary range for some of your entry-level positions?
So we actually have kind of come along with the actual minimum wage. And so a lot of our positions are starting at $15 an hour. And so that's just more of the national state piece of things for the minimum wage range moving up. But there are a lot of positions that will kind of even come in higher than that, just in order to kind of accommodate what we've got for our cost of living here in Colorado, as well as just, being that it's a very important position that we have to have you kind of in with the mix of things as well. So we start at 15, but go up from there.
For students that choose to work with you, do you offer any training opportunities or professional certifications, tuition reimbursement, anything like that for students who want to continue on their career and are just kind of getting started?
Of course. So we do a lot of programs that are actually kind of grow our own and those different pieces of things. So volunteer work is one way that you can really get into the actual hospital system, and whether or not it's, you are there on a Saturday afternoon and you're just meeting and greeting people, or if you're actually taking people kind of around the facility, those different kinds of things. Obviously, with our COVID restrictions, we're just kind of bringing back in our volunteers. For example, we have, folks that'll kind of sit at our surgery waiting area, just, if they're needing to replenish the coffee area or point directions or any of that kind of stuff, that's one way to kind of do different kinds of things. But outside of that, for the most part, with the educational side of things, we do have tuition reimbursement. So if you get into the system and are looking to go back and get your CNA or get your nursing or get any of that kind of stuff, we do $5,250. That's the tax piece of things that we can actually do for. So it's something that we do on an annualized basis. So it's a yearly kind of calendar year, if you will. When you're done with school, we also have loan repayment. And so that's something that we do pay kind of directly to your loan. That is going to be on a monthly basis, and we pay it back directly to the actual loan that you have. So it's great that you can kind of still pay your portion, and then we additionally pay for some of that. Just an example, we do have a new grad program for our nurses. It's called STAR RN. And then that's going to be into the general medical, surgical kind of places, as well as ICU, telemetry, those different fields. But then we also have specialized programs in case you wanted to get to labor and delivery, the emergency room. We actually have something for the cath lab, which is a little bit more perioperatively, as well as an operating room program. And then we do have a NICU one, so playing with the little babies as far as that goes. So lots of different opportunities to kind of get you in the door. And one way to actually help do that, like when folks are in school, we can actually do nurse extern positions. A lot of times those are kind of per diem or as needed. And what they'll end up doing is get into the facility, and that gives you, again, kind of that working interview so that you're able to kind of let people see what your work caliber is and ethic and all that good kind of stuff, and then be able to kind of get right your foot in the door as soon as you're done with school and all that good fun stuff. So we do have lots of opportunities.
That's great. Awesome. Why should students choose to work for HCA specifically over another healthcare organization?
Well, so obviously you'll find kind of here in the Denver area, we do have lots of different hospital settings or systems that are actually here in the market. So obviously there's for-profit, there's not-for-profit, there's kind of half and half, educational based, if you will, like the university system and those different kinds of things. Honestly, you'll find that there's actually kind of a core value or culture that you kind of interview into and kind of see what you fit for. And so while we're a for-profit entity, we actually give a whole bunch of funds back into this hospital systems as well as other hospital systems, and then be able to kind of put money into our community surrounding the facility, so that then it also kind of help builds up those different pieces. So again, it's something that you'll just kind of feel that right feel. And as far as a culture goes in regard to HCA or HealthOne, we truly are kind of family focused and really just want to make you feel like you're at a work family versus just kind of going to work every day. So again, supporting one another and just making sure that, through these unprecedented times, that you're taking care of yourselves and doing those different kinds of things. Something for our system, during the whole COVID pandemic, we didn't lay off anyone. We had COVID pay that we were able to kind of keep people at home. If not, we redeployed folks. Say they were in a surgery center, we were able to kind of get them onto some of the busier floors and working versus just having to lay off folks or have them at home without pay. So it's something definitely that our administrators and our high level folks that are actually based out of Nashville, they took money out of their own pocket so that they could help continue to employ our own facilities and employees there. So it's just very telling as far as the system goes.
That's great. Wonderful. For students that are interested in applying, what is the application process?
So our application process, like many others, are going to be online, but we have made it so that it's much more friendly, that you can actually do it from your phone. You can actually click some of the advertisements that we have out and about there, and it's an easy application process. If you don't have a resume, that's okay. It's definitely something that you can get made up. You can have someone help you. There's lots of different areas online that you can actually kind of look at just to get a format if you want to. And then it's a one-click process. Basically, if you upload your resume, it will pour out all the information, and then you just have to kind of update things from there. But it's really clicker friendly, if you will, and it just makes it real simple for you to go ahead and apply there.
Awesome. And then is there anything else that you'd like to add about the application process, about your jobs that you're offering?
One more thing to the application process. We do, as soon as the application is done, we do a kind of a behavioral based survey. And basically what that does is that just allows our managers to kind of get a little feel about you prior to the actual interview. So it'll kind of give us information about your likes and dislikes and those different kinds of things. It's not anything that has right or wrong answers, but what it does do then is it allows those managers doing the interview to ask specific questions that might work well for you, like tell me about a time when, what happened, and what was the result, so that they can kind of get a feel for what you would be bringing to the table and those different kinds of things. So again, jobs, there are just so many different facets that funnel into the actual hospital systems and those different kinds of things. So while we have registrars actually at the facility, their actual home base or HR is located out of Richmond, Virginia. So we have supply chains that kind of work for the actual bringing supplies into the hospital. So that's a different area that could be behind the scenes and not necessarily have to have that patient care, in case you weren't necessarily wanting to do, you want to impact patient care, but don't want to be hands-on with it. So there's lots of opportunities to do that. So yeah.
Wonderful. Thank you so much, Sue. Do you have any questions, or any students have any questions? I know Sue did request if she could have your contact information.
Of course.
If you just want to put it in the chat,
Okay.
that would be wonderful.
Yeah.
But otherwise, it looks like none of the students have any other questions, and I will go ahead and end the recording now. So thank you so much. Go ahead and get started. Hi guys, if you haven't met me before, my name is Miss Remy. I'm one of the counselors in the Future Center. I am here with Tammy from HCA, and I'm going to let Tammy introduce herself and tell you a little bit about her organization.
Hi, everybody. So my name is Tammy Hewitt, and I'm a recruiter with HealthOne, which is part of a national organization called HCA. We run the HealthOne hospitals here in Colorado. So we have 9 total hospitals and 7 freestanding ERs. We also have numerous doctors' offices, clinics, things of that nature. So we are the largest healthcare organization here in Colorado. Our division does also run into Western Kansas in Wichita with Wesley Medical Center. And I think one of the great things about working for this type of organization is that you can start out here in Colorado, but because we are nationwide, that gives you great opportunities. We have hospitals in almost every single state, and then we do also have some hospitals in the UK as well. So the transfer opportunities, if you're going to be going to school out of state or things of that nature, is really great to be able to stay with the same organization. So that's just a little bit about HCA. What other questions can I answer for you?
Can you tell us a little bit about the entry-level jobs that you offer students who might either still be in high school or are graduating high school?
Sure. So most of our positions do require that you have a high school diploma or GED. So people that don't have that met yet, we do usually tell you that a great way to get started with us is to go to our volunteer services. And if you go to our website, which is healthonecares.com, There's a little search bar up the top, and if you just type in volunteers and click search, it will bring up the volunteer centers for all of our hospitals. And that's a really, really good way to get your foot in the door and get started with us. You can volunteer in, most of our front desk positions, in our gift shops, at our ED, helping check patients in. So there's a number of ways there. And then once you graduate and have a GED or high school diploma, most of our entry-level positions are like housekeeping, food services, transporters, which is a really good way if you want to be in patient care. Transporters usually work throughout the hospital in the ED with radiology, things of that nature, moving patients throughout the hospital and helping out our nursing staff. And then some of the other, a little bit more entry level that do require just maybe at least a small amount of training or a certification that you can usually get within a year or less are CNAs. We also call them patient care techs, PCTs, and sitters. And then we also have lab assistants, which are phlebotomists. You can usually get a phlebotomy certification in 6 to 9 months, and that's a really great way to get into the hospitals. Farm techs, we do like certifications there. You can get that through schooling, or a lot of times you can start out in retail and they'll get you certified, and then you can transition over to the hospitals. 1 to 2 year schooling, PTAs and CODAs. And then we also have, with just a little bit of experience in customer service, registration, and unit secretary reception type positions.
Hey, North Suburban is one of the HealthOne cares, right?
Yep. So HealthOne hospitals, we have Medical Center of Aurora, Centennial Hospital, which is our newest hospital, North Suburban, Presbyterian St. Luke's, Rocky Mountain Hospital for Children, Rose, Skyridge, Swedish, and Spalding.
Yeah, we have a number of students already volunteering at North Suburban.
Mm-hmm.
Is Lori Ward still the volunteer coordinator there?
I'm honestly not sure because I don't do a lot with the volunteer services.
Okay, I'll check and see if she's still doing it. But yeah, we've had a bunch of kids do that.
Great. Yeah, it's a great way to get started and get to know people and kind of get your foot in the door, for sure.
Just a quick plug here as well for students that heard like pharmacy tech or phlebotomy or CNA. Those are all things you can do in high school through concurrent enrollment. So we will pay for you to do that while you're still in high school. So I know all of you guys, I think, are juniors. So if that's something you want to do, come talk to me, because that application is due on Friday and I can help you do that. So if that's something you want to do right out of high school, we can get you what you need to do that.
And it's a great pathway if you go into being like a CNA, if you want to get into nursing or physician or anything like that. If you start with us with a CNA, we have really good tuition reimbursement and tuition assistant programs. We have a STAR-N program for new grads, which gives you a full year of didactic training after you get your BSN. We have partnerships with schools where you can pretty much get your RN degree. If you get an associate's, you can get your BSN almost free if you go through the programs that we offer. So it's a really great pathway into that as well.
For the entry-level positions, what are the salary ranges that students would be looking at?
So they really vary, but the lowest end for a starting position would be somewhere between 14 and 15 an hour. A little bit does depend on location right now as well, just because recently Denver did pass the minimum wage, $15 an hour minimum wage. So anything in Denver will be 15. We're kind of trying to get our hospitals caught up so that we don't have any discrepancies there, but usually about 14 to 15 an hour is starting range.
So for students that are looking at maybe a couple different healthcare organizations to work for after high school, why should they choose HealthOne specifically?
So I think the great thing about HealthOne, like I mentioned before, number one, just being having the national HCA backing is huge, because especially when you're graduating, you don't know where you may be going to college, transferring to college. So you just have so many more opportunities to have somewhere that you might be able to transfer to rather than having to start over if you, move to a different state. So I think that's really huge. We are really big on having a lot of teaching hospitals and hospitals that are just very innovative with technology and things of that nature. And having the national backing, I think, really helps that. If you kind of just do a little bit of research and see how much HCA, the national organization, did during COVID, it was just absolutely huge. We were a huge part of PPE distribution across the world, huge part of, helping research and get the vaccines out there. So just having that national backing just gives you such a huge base of just technology and, all that good stuff. One of the things that I think that HCA did really good during COVID, which a lot of people, especially, in high school, may not realize, healthcare industry, you would think everybody was safe, but so many healthcare organizations had huge amounts of layoffs simply because the only people being seen were in ICU. So if you weren't in the ICU, there wasn't a need. Surgeries weren't being done, doctors' visits weren't necessarily happening. HCA worked really, really hard as a national company, and we were able to go through the entire pandemic so far, not one layoff. Every single person was retained across the entire nation, which is huge.
It's amazing. For students that would like to apply, what does the application process look like?
It's pretty simple. It's just an online application. So just going to that healthonecares.com, and there's a careers link up on the top of the page in the dark blue border. You just click on there. You don't have to upload a resume, but if you have one, it's preferable. But you can just enter in your work history, and that can include volunteer, school, if you've done school programs, even just house sitting, babysitting, any type of work that you've done, you can just enter it right there. There's a few legal questions that you answer and submit. Usually it doesn't take, there is an assessment that we have you do simply to see how you kind of work, and it just kind of helps us generate our interview, how we interview you. But the assessment doesn't usually take more than 15 minutes, in the application process, maybe 10.
Awesome. Great. Well, that's all the questions that I have. Students, do you have anything you'd like to know about, or you have questions about specifically?
And if any of you guys are interested in that volunteer opportunity, I'll give you the lady's email. That's the coordinator. Like I said, we've had a bunch of kids go into that, and it's been really beneficial for them.
Mm-hmm.
All right. Is there anything else you'd like to add, Tammy?
No, just that, I personally do recruit for some of the entry-level positions. So when they're ready, if you want to pass on my information, I do the environmental services, which is housekeeping. I also do the laboratories, which is our phlebotomist lab assistants. And I do the pharmacy. So I'm a good contact for all of those areas. But even if they're interested in other areas, if people have questions, feel free to email, and I can get them in touch with the recruiters that are correct for the positions they're looking at.
Thanks. And I did actually just get a couple questions in the chat.
Okay.
I asked, so what would be the closest locations or hospitals to us specifically? Like
Westminster, would be North Suburban.
North Suburban.
Because it's right off of I-25 and Thornton Parkway, I think.
Yeah, it's on Thornton Park, right on Thornton Parkway.
What are the hours for the positions that you'd be hiring for?
Really variable. So it depends. So a lot of our shifts have morning, evening, and night positions. So just depending on the unit, some of the morning positions start anywhere between 5 a.m. and 8 a.m. Afternoon positions usually start around noon. Evening, it just kind of varies. We have a lot of flexibility. That's one of the great things. Hospitals run 24 hours a day. So, we pretty much have people running all the time. We do also, if somebody's not necessarily needing benefits, if they're on their parents' benefits and their schedule is not going to be conducive to doing like a full-time Monday through Friday type thing, We do have what's called PRN for a lot of our positions. It's a non-benefited position, and it's just kind of as needed. So those, they can kind of work a little bit better around student schedules, especially if they're in college and that type of thing. Just kind of filling in here and there, doing more weekend work, evening work, that type of thing. And you do get a little bit of bump in pay since you're not getting benefits. You get a 16% bump in your pay for being PRN. So that's a great opportunity to look at as well.
Would those students also be eligible for tuition reimbursement, or would they need to be full-time for tuition reimbursement?
You do have to be at least part-time for all of our benefits.
Okay, perfect. Just curious, because that is an amazing deal for students that are thinking about college, but a lot of our students also work during college, so it's a lot better, I think, than just kind of having a random part-time job.
Yeah. But even with part-time, with students, a lot of times they once they bring them in, even if they bring them in PRN and they get their schedule set, they can work a part-time schedule, just kind of working around their classes.
Great. Awesome.